Congestive heart failure is a term for the clinical syndrome that occurs secondary to severe cardiac disease. In this disease process, the heart is no longer able to maintain normal venous capillary pressures, cardiac output, or systemic blood pressure. Due to whatever the underlying cardiac disease is in the heart failure, the blood returning to the heart cannot be pumped into the vascular system at a rate or volume that the body needs. In most cases, the result is pulmonary edema and effusion. Pulmonary edema and effusion occurs due to the heart's inability to pump blood efficiently, and blood is backed up into the pulmonary veins. As the pressure builds in the pulmonary vessels, fluid is pushed from the pulmonary capillaries and into the lungs and the chest cavity. This results in breathing difficulties and respiratory distress, which are usually the first signs of a congestive heart failure a pet owner will notice, because earlier symptoms can easily go unnoticed. Heart disease can develop and present acutely, but this is rarely the case. Heart disease is usually a progressive disease that owners fail to notice until the disease is in its late stages. Congestive heart failure is most commonly caused by chronic diseases that result in decreased myocardial contractility, such as with dilated cardiomyopathy, hypertrophic cardiomyopathy, by severe regurgitation or shunting of valves as with chronic valvular heart disease, or other diastolic dysfunctions such as pericardial effusion. Dilated cardiomyopathy is the second most common form of heart disease in dogs and has also been seen in cats. DCM is a disease of the heart muscle itself, where the animal's heart fails to pump effectively. The heart contractions weaken and blood is not pumped to the body effectively. Over time, heart stretches and enlarges, which further decreases its ability to pump blood around the body and impairs systolic function. Causes can be genetic, toxin-induced, malnutrition, or viral. Taurine deficiencies in cats' diets have been proven to contribute to developing DCM. DCM is most commonly diagnosed in large breed dogs, with Doberman Pinschers, Great Danes, and Newfoundlands being a few of the most commonly breeds to be predisposed. Hypertrophic cardiomyopathy is another form of myocardial disease. HCM is the most common heart disease in cats, but it is very rare in dogs. With HCM, the left ventricle loses its ability to relax appropriately after contraction, and often the muscle wall begins to thicken, which results in a buildup of blood in the left atrium and the pulmonary vessels. Thromboembolism is also a major concern and can be secondary to the development of HCM. The difference between DCM and HCM is that with DCM, the ventricular chamber's space is increased and stretched out. With HCM, the actual muscle wall is thickened. A specific mutation has been identified in Maine Coon and Ragdoll cats, but the domestic shorthair is the most commonly diagnosed. Chronic valvular heart disease typically occurs with the mitral valve and is known as mitral valve disease. Mitral valve disease is the most common heart disease diagnosed in dogs. With this disease process, the valve slowly degenerates over time and allows for blood to be regurgitated back in the atrium when ventricular contraction occurs. When this regurgitation and shunting happens, the backflow of blood builds up and is forced into the pulmonary vessels, causing transudation into the lungs and pleural cavity, causing pulmonary edema and pulmonary effusion. Chronic valvular disease is most commonly diagnosed in smaller dogs, with the Cavalier King Charles Spaniel, Toy Poodle, and Papillon being a few breeds to be predisposed to having high occurrences. Okay. Right versus left-sided heart failure. The left side of the heart brings oxygen-rich blood from the lungs into the left atrium, then to the left ventricle, and then out into the body. When there is left-sided heart failure, the heart struggles to pump blood out of the body and fluid backs up and generally builds up in the lungs and chest cavity. The right side of the heart brings in oxygen-deficient blood from the body back into the heart to be reoxygenated. Right-sided heart failure is usually concurrent and due to left-sided heart failure, because the right side has to work harder and becomes weaker trying to compensate for the left side. With right-sided heart failure, fluid usually builds up in the body and abdomen, presenting in peripheral edema and ascites. Symptoms that can be seen with heart failure include dyspnea, tachypnea, cyanosis, cough, claps, exercise intolerance, dulmentation, syncope, abdominal distension, and particularly in cats, sudden death and hind limb paresis. Heart disease and heart failure can sometimes be caught early with a physical exam. As with all patients, a full physical exam should be done, but special attention should be paid to cardiogenic abnormalities if heart disease is expected. Common exam findings with heart failure include heart murmurs, galloping beats and/or abnormal rhythms on auscultation of the chest, bradycardia or tachycardia, abnormal pulses or pulse deficits, muffled heart or lung sounds, crackles or abnormal lung sounds, cough, cyanotic or pale mucous membranes, increased capillary refill times, jugular distension, decreased mentation, cachexia, hind limb paresis, syncope, or cold peripheral limbs. Diagnostic testing for congestive heart failure includes radiographs, electrocardiogram, echocardiogram, ultrasonography, and blood testing. For radiographs, 3 thoracic views are the minimum, with those shots being right lateral, left lateral, and ventral dorsal. With radiographs, you are looking for any heart enlargement, abnormalities of shape, and placement in the thoracic cavity. You are also looking for signs of fluid in the lungs and thoracic cavity, as pulmonary edema and pleural effusion are the 2 most common secondary problems that accompany congestive heart failure. An additional 3-view radiographs may be taken of the abdomen in rare cases of ascites that can present with certain types of heart failure. Taking a radiograph to diagnose congestive heart failure. Generally, you would want to start with your 3 views of thoracic radiographs: ventral, dorsal, left lateral, right lateral. Generally, when you're taking the radiographs, you're looking for signs of pleural effusion or enlarged heart, globoid-shaped heart, any irregularities like that. In certain cases, you might want to take 3 views of the abdominal to check for ascites. An EKG is a useful tool that is used for monitoring the electrical activity of the heart. The EKG allows us to see if the heart has a normal rhythm or an arrhythmia. If arrhythmias are present, it can help point in the direction of where the heart abnormalities are happening and when it is happening during depolarization and repolarization. Now what we're doing is we're hooking up ECG leads to check the heart's electrical patterns and the heart's rhythms. What you do is you hook up your 3 ECG leads. And then this monitor will pop up your different heart rhythms. It would show up if you have any arrhythmias, if there was anything going on there. Ultrasonography is useful for identifying valve regurgitation and observing how cardiac valves are functioning when performing an echocardiogram. The echocardiogram is the diagnostic tool of choice for a definitive diagnosis of the underlying heart disease that is causing congestive heart failure. Ultrasonography should be used to take a quick view of the heart and to rule out pericardial effusion, which appears as dark anechoic shape surrounding the heart. For blood testing done on a suspected CHF patient, a PCV-TP should be performed to establish a baseline and could show a decrease in PCV due to increased water resorption, as poor perfusion enhances ADH activity and may be an indicator of the severity of heart disease. BUN and creatinine should also be checked to establish if renal insufficiency exists due to poor perfusion. Electrolyte levels should be checked to see if there are any deficiencies, as low potassium levels can predispose the patient to arrhythmias. Lastly, venous blood gases should also be monitored to assess perfusion and oxygen delivery to the tissues. Once heart disease has been diagnosed, chronic treatment should be initiated within 24 hours of stabilization. Chronic treatment consists of monitoring the patient, providing adequate nutrition, and administering appropriate medications. There are several medications that can be used to treat congestive heart failure and include diuretics, positive inotropes, ACE inhibitors, vasodilators, and beta blockers. Diuretics, such as furosemide, are the most effective agents used to decrease circulating blood volumes and reduce signs and symptoms of edema and effusion. In an emergency situation, furosemide is generally given IM or IV every 1 to 2 hours until the clinical signs of pulmonary edema and effusion are under control. The dose is then tapered down to the lowest dose possible that keeps the animal's sleeping respiratory rate normal. That dose is then used to keep the symptoms of edema and effusion under control for chronic management of the CHF. The lowest effective dose of furosemide should always be used, and it should be used in conjunction with an ACE inhibitor, because long-term use of diuretics increases ROS activation. Positive inotropes, such as pimobendan, dobutamine, and dopamine, are used to increase contractility of the heart. Pimobendan is the inotrope of choice and also has vasodilating properties to it. The combination of positive inotropy and afterload reduction has shown improvement in dogs with DCM and mitral valve disease. However, it is not approved for use in cats and is contraindicated in cats with hypertrophic cardiomyopathy. Dobutamine and dopamine are generally given as a CRI and therefore are not very practical in the chronic treatment of heart failure, but they may be useful in acute treatment. Angiotensin-converting enzyme inhibitors, such as enalapril, blunt the increase in systemic vascular resistance, hypertrophy, and aldosterone release caused by angiotensin II. ACE inhibitors work by improving cardiac output, vasodilation, and reducing left ventricular filling pressures, and thus reducing pulmonary edema. The greatest improvements have generally been seen when using ACE inhibitors in treatment of DCM, but they are also used in treatment of mitral valve disease. However, studies of use in cats are limited, and there has been no benefit shown in treating HCM. It should also be noted that ACE inhibitors are not emergency drugs and have no real use in the acute treatment of CHF, as its effects are commonly not seen before 2 to 3 weeks. Vasodilators such as nitroprusside, nitroglycerin ointment, hydralazine, and amlodipine are used to decrease resistance to blood flow by dilating systemic arteries. Nitroprusside is used in acute treatment via CRI and reduces preload and afterload. Nitroglycerin is also used in acute treatment and is absorbed subcutaneously. Hydralazine is typically reserved for dogs with mitral regurgitation due to mitral valve disease or an acute CHF treatment when nitroprusside is unavailable. Hydralazine reduces resistance in the left ventricle, resulting in more blood being pumped forward and less blood backflow into the atrium. Amlodipine is a calcium channel blocker with only peripheral vascular effects. Its actions are similar to hydralazine in that it decreases mitral valve regurgitation and pulmonary edema, but it has less side effects. However, amlodipine has a slower onset of action than hydralazine. Beta blockers, such as atenolol, are commonly administered in cats with hypertrophic cardiomyopathy, primarily to reduce systolic anterior motion of the mitral valve. However, evidence that this results in clinical improvement or prolonged survival are lacking. Acute treatment of congestive heart failure often focuses on reducing pulmonary edema and effusion while trying to improve the animal's oxygenation and decrease respiratory distress. Most animals that present with CHF are often cyanotic and have poor perfusion due to pulmonary edema. Oxygen therapy can be given by an oxygen cage, nasal cannula, or flow-by, with the latter being the most effective and preferred treatment. It is important to assess the animal's oxygen saturation by measuring SpO2 levels and assessing blood pressure to give an idea of perfusion. Extra care must be taken not to distress these emergent patients. While the patient is receiving oxygen therapy and SpO2 levels and perfusion are improving, it is important to place an IV catheter and run diagnostics such as radiographs and ultrasonography. If effusion is present, then a thoracocentesis or abdominocentesis may be needed to remove excess fluid, and IV diuretics are also generally indicated to relieve effusion and pulmonary edema.
A couple other things you would want to check with congestive heart failure is check the systolic blood pressure. With certain types and progression of congestive heart failure, you could have hypotension. So I'm demonstrating here taking the systolic blood pressure. We have a Doppler sphygmometer. What you would do is I'm going to take the Doppler crystal, you put it over an arterial vein, you pump up the meter reading. Another tool that we will use is a pulse ox to check for SpO2. This would tell you the oxygenation of the blood with congenital or congestive heart failure. A lot of times with pulmonary edema, you'll have breathing problems, you'll have a decreased perfusion, decreased oxygenation of the blood. So using this, you would take your SpO2.
Congestive heart failure is not a curable disease state and is a progressive disease. However, with proper and adequate treatment, some animals can increase their life expectancy and quality of life slightly. The animals should be monitored frequently and have diagnostic testing done regularly to ensure that current medication doses are still adequate.